Hello everyone. I have some good news this week. The county health clinic started vaccinating people in more eligible groups, most notably people aged 65 to 74. We could begin doing this because most people in the first categories, healthcare workers, first responders, and seniors over 75, have received their vaccines. To get a vaccine from the county health department, you need to pre-register to get your name into the system. Then you will receive an invitation to make an appointment when vaccines are available, but you may not receive that invitation right away because the supply of vaccines is still limited, but you will be contacted as doses become available. Retail pharmacies, mass vaccination sites, and hospital systems also continue to provide vaccinations, but unfortunately, each of those providers have a separate registration and scheduling system. I know that this system is frustrating, confusing, and time-consuming for all of us. We continue to ask the state for a more organized system with a single point of entry to sign up for vaccines and to schedule. But regardless, everyone will get vaccinated. It will just take some time. For the county health department, we think we will continue to have about the same number of vaccines for the next couple of weeks. Last week, we did get some extra doses of the new Johnson & Johnson vaccine, which we administered. I'm happy to report that overall, our case counts are relatively low in Montgomery County compared to other areas around the region and the country. Some people say to me that we should open things back up because our numbers have come a long way down from the peak of the last wave. And I try to remind them that those numbers are low because we implemented the necessary restrictions, and they are low because our residents who've been willing to follow the guidelines, even as their lives have been severely disruptive, continue to do so. Most importantly, our numbers are still higher than they were in the summer. We are fortunate in Montgomery County that our residents understand that the measures we take are central to saving lives. I understand that restrictions are being lifted by the state and elsewhere around the country, and I know that the CDC has relaxed some guidelines for people who are fully vaccinated, which most of us are not. But I am concerned about the new COVID variants that are spreading. According to the CDC, these variants seem to spread more easily and quickly than other variants, which could lead to more cases of COVID-19. The CDC and Dr. Fauci have warned against reopening too quickly. All of us have been patient for 12 months now. We've managed to have some of the lowest rates of infection. This is not the moment to abandon all caution. An increase in the number of cases will inevitably put more strain on our healthcare resources, lead to more hospitalizations, and potentially more deaths. So far, studies suggest the current vaccines can protect us against the worst effects of these variants, but the information is still uncertain. This is being closely investigated and more studies are underway. In the meantime, the CDC recommends we keep with our public health strategies. That includes getting vaccinated, wearing masks, hand washing, physical distancing, and testing. Testing is important as it helps us track where the virus is spreading and how well we are doing to stop the spread of the virus. And even more importantly, testing helps us identify where the variants are in the community so we can track their impact. The weather is beautiful this week. I hope everyone has a chance to get outside and enjoy the sunshine. I want to end on a brighter note. The vaccines are indeed a game changer, and our COVID case and hospitalizations are going down. Let's not lose our momentum. When it's your turn, get registered for a vaccine and get your appointment scheduled. Let's all wear masks. Let's continue to physically distance. We are getting there together. Thank you.